All right, here we go. Well, we don't have a lot of time together, so I want to maximize it. And those who make it late can always go back and watch our recording. So welcome, everyone. My name is Natalie Sampson. I am a co-lead of our Community Engagement Core, which is part of the Michigan Center of Life Stage Environmental Exposures and Disease. Most folks know us as M-LEEaD. And this is work supported by a National Institute for Environmental Health Sciences P30 grant. And I want to acknowledge that the work we do is very much guided by an advocacy board of leaders from Southeast Michigan. So we have Eastside Community Network, Detroiters Working for Environmental Justice, Detroit Health Department, Michigan Department of Health and Human Services, Sierra Club, We the People Detroit, Detroit Hispanic Development Corporation, Ecology Center, CHAS, and Green Door Initiative. Hopefully I didn't leave anyone out. And you should follow our work because we do quite a bit to try to connect policymakers, youth, communities, researchers on issues of environmental health and justice. This is through translational informative materials, multimedia, legislative forums, partnership, little small grants we give out. And this particular session is part of something we call Residents and Researchers. So we have many past webinars posted for anyone interested to go watch on topics ranging from gentrification to plastics to air quality standards to disaster preparedness and many, many others. And we'll share the link with you all so you can track on that. But we're really excited today we're going to head to Santa Ana, California, and we're going to learn about a community academic project that our guests have collaborated on. And they're going to tell us the story of their work, about how they bring in historic knowledge to understand legacy pollution and what that means for their communities. In this case, we're going to talk about lead, but I think some of them have expertise in other such exposures. So I'm really excited to welcome our guests. First, we have Dr. Juan Rubio, who is a new assistant professor in the Department of History at University of California, Riverside. Coming to us originally from Argentina, Juan has learned from many Latin American historians, as well as inspiration from the field of environmental history. He studied conflicts connected to the rise of copper industry in Peru and works closely with local groups to advocate for soil remediation and other environmental justice issues, in issues specifically facing Indigenous communities. We also have PJ Flores and Maya Cheav from the Orange County Environmental Justice Group. PJ is the executive director, and she leads many different issues, obviously, related to environmental justice. She has a long history of grassroots organizing, from her activism as a student at UC Berkeley to fighting wage theft, advocating for workers' rights. And now she coordinates different issues related to public lands and supporting Indigenous activists in Orange County. She's also a storyteller and musician. Maya came to this work in 2022 at the org after graduating with her degree in environmental science and policy with a minor in English, also a creative mind who makes jewelry, crafts, and clay. She grew up in Long Beach, and one of the most diverse cities in the US, which I think is important to note, and is really learned from her work and concerns in that community related to the freeways and the port, and brings that expertise to her organization. So I'm going to hand it off to our fabulous team here so we can learn about the work that they've done. Please use the chat. Please use the Q&A function. I will track on those, and we'll try to leave some time at the end so that we can ask some questions about the work that they do. So I think Juan will kick us off.
Thank you so much, everyone, for coming. And thank you, Dr. Sampson and Robin and Meredith, everyone that worked on this series. I think it's really important to highlight, the research that's been done at the intersection of environmental health and justice. And we're going to give you our take on the field and our experience on the field. We're an interdisciplinary project. We're a coalition of researchers and activists and volunteers. And we've been working on this issue of lead, specifically soil lead, for quite some time now. The founders, so to speak, of this project began this investigation in around 2017 after, a reporter actually found high levels of lead in the soil in Santa Ana, right? And there was a kind of public demand for an academic intervention that could really survey the ground, literally. So that's how the project started. I got involved around like in 2020 when the results came out, and the big question was like, yeah, there's clearly lots of lead in Santa Ana, but Santa Ana is not known for being a smelter town or having some sort of heavy industry, particularly in the areas where the lead was located. So where is it coming from, right? And that's when I got involved as a historian, and I tried to bring sort of my expertise to try to figure out that question, right? So then that's how the interdisciplinary dialogue began, and we started kind of doing regressions and going to the archives at the same time, right? So it's very interdisciplinary. So I'm going to tell you a little bit about the history of lead and our history of lead, and then we'll tell you more about the project, right, and what we've been doing, and how actually this coalition is really breaking with a really complicated history behind the science of lead, and particularly the industry of lead, right? So there's my argument overall, and our argument overall is going to be that these partnerships are actually not just doing creative work or interdisciplinary or just being more engaged, but they're actually breaking with a research paradigm, a research program that has had at its heart the main, at its heart has had the full force of sort of capitalist exploitation, racial discrimination, and environmental injustice, right? So we'll get there, but that's my general argument. Let me first say what I'm not going to tell you, right? So this is the story that I will not want you to leave with after this talk, and this, it might be the story about lead that at least I had before I started this project, and it goes something like this, right? There was a lot of lead in many products, including paint, and we put that paint everywhere because we didn't know. And when we found out, we banned it, and we started removing, and now we do sort of, lead mitigation and interventions to get rid of that paint. That is sort of a fairly liberal story of technological progress, right? So we didn't know first. We just didn't have the science, right? We just didn't have the tools. So when we've got the tools, now we're making up for that, and we are remediating it, so to speak. I will start the story slightly different. I will start the story with the lead industry itself. The lead industry basically started after the Civil War, got consolidated into big mining conglomerates that not only monopolized the extraction of lead, but also began integrating into processes of selling lead, right? Manufacturing with lead, so manufacturing paint, manufacturing toys, and other products. And after 1923, started manufacturing gasoline, right? So the Ethel Corporation was a conglomerate, but it was a corporation made of Standard Oil, so fossil fuels, the car companies, so it was General Motors, and DuPont, the big chemical company, right? So you have the kind of the corporate bingo. And that Ethel Corporation pushed the production of leaded gasoline throughout the 20th century. Even in the 1920s, there was already quite a bit of research suggesting that it was poisonous. And there were safe alternatives that could be used, mainly ethanol blends, right? So my first point is is that the lead industry was organized, it was integrated, and it pushed lead into the market with the corresponding sort of corporate science to go with, right? And really crowded out and casted doubt on alternatives, right? This was also the story of lead paint, by the way. But we're going to focus on gasoline. And the reason why we're going to focus on gasoline is because gasoline was the primary source of environmental emissions of lead. And there you have some figures. A huge legacy in terms of how much lead was being released into the environment per year. And this is at a global level, right? Lead and gasoline was used everywhere, right? Well, not exactly everywhere, but large scale. So there you have it. Millions of tons of residue were left in the US alone, right? Now, this legacy interacted with other capitalist processes and other sort of processes or structures of power. So let's think for a second, right? So it's the 1950s, right? Post-war boom in terms of housing, in terms of economic development, and in terms of building infrastructure and expanding the network of highways and suburbs and basically car infrastructure, roads. Now, that development's not happening everywhere or evenly. So you have cities like Santa Ana, where there was quite a bit of traffic. Actually, Santa Ana had received a lot of traffic from LA and San Diego. So, and in the 50s, it started like expanding outward. So if you look at the maps, and we've looked at the maps and at the aerial photographs, you see that the downtown expands out, right, in concentric circles. Then you have other inner cities, right, like, I don't know, New Orleans, even Minneapolis. And I'm talking about these places because that's one of the few places in which this has been systematically surveyed. Now, that expansion is not happening evenly. Who is actually moving to the suburbs? It's mostly white people because of histories of legacies of redlining and actual formal segregation, but also because there were mechanisms that were like, the loan mechanisms. I'm not going to get into this, but like there were mechanisms that were only available to white people, and there was also informal discrimination that did not allow people of color to move to these neighborhoods. Now, these neighborhoods are new, and they're receiving less traffic compared to the inner cities. The inner cities, mostly, they have not only high congestion and lots of lead going into the air, but they also have a process of systematic de-investment. So these houses have peeling paint because most these communities of color are not owners, are renters. And because of discrimination, they cannot have the market power to push for renovations and so on, right? So you have peeling paint that is poisoning children mostly, and you also have lead in the air, right? And in the soil. So lead exposure interacted with segregation and housing discrimination. And social movements during this time actually approach it as such, right? So I have a picture here of the Young Lords in New York, which is an example of like seeing lead and lead poisoning as part of social justice, right? As part of a social justice agenda that is trying to fight not only for just kind of blood testing and treating the sick kids, but housing, justice, food security, and just overall a fight against poverty, right? Now, during this time, public health the field of public health is actually also doing really important work to not just document the effects of poisoning, but also understanding lead poisoning in this kind of more holistic way, now we call it environmental way, right? And so they're looking at sort of air emissions. There's really good research in the 70s and 80s, research that we sort of forgot about in a way. At least when we reviewed the literature on lead, we just didn't find those references because people go back like 15 years, 20 years when they do their literature reviews. It occurred to me to just go back to these like typewritten reports, right? But this is like a really amazing science and surveys, like they were compiled with like very meticulous sort of science about how much lead was coming out of the cars and how it deposited and so on. So lead science was sort of very environmentally aware during this time. But that's not the case for the 70s and 80s. Well, mostly the 80s, right? Like there's a turn that comes with a much bigger turn in politics and in public debate and ideology that moves away from understanding things in this kind of social, holistic way and focuses on the individual, right? So Reagan comes in the US, Thatcher in England. There's a systematic defunding of public health and environmental agencies, and there's also a process of deregulation. And with that also comes a turn in the field of public health towards just focusing on secondary prevention and basically just seeing lead as a biomedical health issue that should be addressed at the individual level, right? Like, okay, we have sick kids, how can we treat them? Or how can we maybe prevent them from getting sick in the sense of like, well, we should do educational campaigns so we can teach them, teach families to not let kids eat paint chips, right? Or we focus on foods, and there's a whole racialized component to this, right? Like, like Mexican candy or Indian spices. So it's those poisoned foods, right? Pottery. So during this time, also, there's a strong focus on paint as the primary source. Why? Because leaded gasoline was banned in the 1980s, right? In 86, it took some time, but it was phased out in the 80s. So by the end of the 80s, there's like kind of a washing of hands and saying, okay, we banned gasoline. So if there's poisoning now, it's mostly paint. That's the assumption. And if you review the literature, it's like 99% about paint or dust, but the dust is never problematized as where's it coming from, right? And coincidentally, this lines up with a lot of the corporate science that the lead industry, which by the way was organized under the Lead Industries Association, that had a sort of science wing. And there's documents actually showing that the lead industry wanted this change to happen. Why? Because throughout, the 60s and 70s, after the 40s, really, when they really stopped producing paint, lead paint, the primary product was gasoline. So they wanted the attention to be away from gasoline and to be focused on lead paint. So we can talk more about that in the Q&A, but as a recap here, we have an issue that was produced by a specific history of corporate development and I would add also infrastructural and housing development, mixed with sort of a history of racial discrimination. And there's a movement, like a social movement and a scientific field that is addressing it as such, right? Looking at it as an environmental issue at the community level that is multifaceted, and it has to do with capitalism and exploitation and poverty. And there's a move away from that focuses on the individual. So that is the lead science that we inherited as a group when we took it on in 2017, in a way. And now I think I'm going to pass it on to Maya to explain the ways, and we can sort of all jump in here, but explain the ways in which this group, as well as others, are moving away from that individualistic approach and really focusing on local histories of exploitation that are intertwined with this legacy of lead, not as a mistake or as an accident, but really as an inherent part of our petroculture, right? Our sort of capitalistic, petrocentric way of doing things, right? So here, and this is to wrap up my section, here's a map of Santa Ana where you can see the high concentrations of lead in the downtown area, right? So that the red part is mostly where the downtown is. And this map like really shows how it's like an environmental issue, right? It's a community thing. It's a community level thing. So OCEJ has been, pushing for this to be understood by the public offices as an environmental issue, right? Like, look, we cannot be just like treating isolated, cases of poisoning. We have to understand lead is not safe at all. There's no safe levels of lead in the soil. So the bottom line is, we have to address it, as a collective, as a society, as a community, right? So we can talk more about how we did this project. I think I'm going to pass it on now to Maya. If you have any questions about sort of the makings of these maps, we can talk about it. But the last thing I want to say, if you want to ask about this, feel free, is that through our research, we were able, and we can share the paper that we published in Environmental Research. We managed through historical research and archival work to correlate this map with a map of roads, historical roads, not contemporary roads, as Santa Ana was developed. And we found that giving this correlation, we estimate that leaded gasoline was the most likely and most prominent contributor to the soil lead crisis in Santa Ana. And with that, I'm going to end. Maya, go on.
Thanks, Juan. To build off a little bit what Juan was talking about, earlier in the presentation, he had mentioned that there was a reporter who had kind of brought this issue to the attention of the city of Santa Ana. Her name is Yvette Cabrera, and she started off as she was a local resident of Santa Ana and reporter who now works on a nationwide level, and also released a TED Talk about this issue in particular very recently, I think a couple months ago. But yeah, she was doing work kind of related to thinking about the school to deportation pipeline, as well as just looking into concerns from the community about the soil, about lead. And she had done her own research using a device called an XRF scanner, which stands for X-ray fluorescence, which basically is it almost looks like a barcode scanner that you would find in a grocery store. And you hold it directly above any surface, including soil and such. And it can tell you the levels of heavy metals or just metals in general in a object or service. And so that information, I think, was brought to the city, and the city kind of just downplayed the experiences of the residents and the concerns that were shared by Yvette and the rest of the community members, remarking that the XRF research that Yvette had led was not scientifically strong enough, which is not true. And there's a lot of scientific papers that kind of back the use of this device. But with all that in mind, that's where OCEJ, as well as some other organizations like UCI, which is the University of California, Irvine, and Jóvenes Cultivando Cambios, which is a youth group, which stands, I think, translates to Youth Cultivating Change. And we three groups kind of collaborated to do like a more extensive research process with all of the funds and equipment that the university had access to. And that's when we created this map and did, I think, 1,555 samples and found that over 50% of them tested unsafe for the levels of lead in the soil, according to the California EPA standard. And as Juan was pointing out on this map before, if you look at the red and orange areas, that's kind of where the downtown areas of Santa Ana are based, and central areas as well. And the folks who live in those areas are people of color, people who are lower socioeconomic status, people who have a high school education or less than that, renters more often than homeowners, residents without health insurance, residents with immigrant status, residents who have a very limited English proficiency or no English knowledge whatsoever, and Latinx residents in particular as well. And then in the areas that are blue and green on that map, which unfortunately is covered a little bit by our logo, but you can see it kind of towards the lower end of that map, that is closer to the border of Costa Mesa. And that city is known to be very high income and primarily white. And there's like a vast difference in, the lead concentrations that are there. So you can see this direct correlation that has to do with race and class, and kind of points to this issue being much more systemic than the individual prevention approach that Juan was talking about, that's focused on these scapegoat items of Mexican candy and Indian spices and things like that, that also feel very, racially motivated and charged. There are still healthcare agencies local to us and probably more throughout the state that kind of focus on this individualized approach, telling parents, like, make sure your kids don't eat Mexican candy or eat these certain spices, which feels very like they're putting the blame onto the parents of the children who are affected, as opposed to looking at it at a wider scale view. And so that's why we're trying to shift this dialogue and kind of show that this issue is much more systemic than we thought. Because of course, if the lead is in the soil, it's not like everyone can do something about that. That has to be citywide kind of healing and treatments to address this issue. And yeah, I think I'll leave it at that, and then we can go into the next slide. You can go to the next slide, Juan. Thank you. And so with all of that work, with that data that was shared on the map, community groups such as OCEJ and other groups like Green MPNA, which is a neighborhood association that is close by in Santa Ana, and works very closely with OCEJ, as well as other community groups, pretty much advocated for this issue and pushed for it in city council, flooding city council meetings, doing protests and rallies to kind of draw the city council to pay attention to the issue and listen to the residents. And some folks were very dismissive. Like, I believe, I can't remember which person did it, but someone who was in like city staff remarked like that this wouldn't be an issue if people would tell their children to stop eating dirt. So they were convinced that, you know, kids eating dirt was like the root cause of this issue and how kids are getting affected by lead, and failing to recognize that it's a much bigger issue than that. And eventually, with all the work that the community groups had been doing and residents, we were able to get some policies successfully passed in the general plan update in 2022 for the city of Santa Ana, which included more access to blood lead testing for residents, as well as remediating the soil, which just means removing the lead from the soil, prioritizing a method called bioremediation, which we will discuss more in this slide. But of course, even if those policies are written into law, that doesn't necessarily mean they're being implemented. And so there has to be a lot of proactive action from us and other community groups to kind of push the city forward in trying to get these things rolling. Yeah, okay. So with regard to bioremediation, basically what is typically done when there are heavy metals or toxics in the soil, traditionally cities will typically do a method that we call dig and dump, which is very self-explanatory. They have like a large force of labor to dig up the soil and then move it somewhere else. But there have been studies shown that kind of noted that a lot of the time these soils just get moved elsewhere. So there's still the lead and other heavy metals still present in the soils, but they're just getting moved to a different community, which we don't want that to happen because it's not addressing the actual problem and likely going to affect another community that is marginalized and deals with a lot of other methods of oppression as well. Like, for example, I think there was some type of like battery plant or something where there was lead in the soil, and that lead-laden soil got moved really close to a indigenous reservation in Arizona. And I think I have an article about that somewhere. I'll just have to like dig around and find it if anyone is interested in reading it. But yeah, it's proven that this has happened multiple times, and so we don't want that to happen, which is why we've been working on this method of bioremediation, which was first brought to us by an expert in this field, who's also actually from UC Riverside and got her PhD there, Dr. Danielle Stevenson. And so basically this process uses native plants and fungi to absorb lead out of the soil. So it concentrates it into the plant, and then there's a much smaller amount of bio-waste hazard to deal with that could be disposed of safely, as opposed to, you know, just acres of soil. It's a lot more concentrated. And so we've been trying to utilize this method to work at different residences in the Santa Ana area, just because it's been a bit tricky to get this rolled out on a larger scale with the city. Again, as I mentioned, even though we have those policies, it still takes a while to put them into practice. So we've been going on our own to talk to local residents and see if they were interested. And this past year, we just started our first ever soil practitioner cohort, which was an idea that was started a long time ago. And we had been very eager to work on with UCI and other groups as well. And so basically we had 15 community members who were trained in learning how to do the soil sampling and the bioremediation process. And they got a stipend for learning how to do this work, as well as a certificate for working on hazardous waste sites that they can use if they would like to do that in the future with other hazardous substances as well. And typically that certification process costs $250, but we cover that for the cohort members. And so it was, I think, like a 12-week program, I think, where they learned how to do that, and we ended up implementing it at these sites. And so we're planning to keep this going every year moving forward so that we can keep spreading this knowledge and bring this to the community so that we can start to do this work ourselves, even if it's taking the city a while to kind of jump on that train. And I see a question in the chat that says what specific types of plants and fungi were used. So it's kind of specific to each area. So since we're in Southern California, it may not be the same in other areas of the country, but for us, we used California buckwheat, California telegraph weed, and then mycorrhizal fungi, which I believe should help in any area, the fungi specifically, because it's known to help make the root system of these plants larger. So it assists in spreading that area. And then I listed a lot of things that we worked on to kind of do outreach and education about this work. For example, our soil-led scavenger hunt, which is basically like this narrative role play thing with puzzles, as well as a comic book. And these two items are kind of used to interact with our younger audiences because lead primarily affects young children. And so we want to make it as engaging for them as possible to learn about. Then we've also had focus groups talking to residents to see what solutions they wanted to see. And all of that information was summed up into our environmental health equity action plan, which was brought to public officials, city agencies, state agencies, to talk about like solutions that we want to have implemented, and then just general educational presentations with different schools and things like that. And then we also have this initiative that we're trying to work on that we just started kind of discussing of Plono OC, that's what I'm calling it for right now, but title is tentative. But that basically is some work that we're doing with Juan, UCI, and other groups to kind of make the soil testing a larger initiative throughout Orange County, which is the county that Santana is located in, because we do believe that there's a lot of other cities likely throughout the United States that are affected by this because leaded gasoline was used everywhere in the US. And it's probably concentrated in a lot of the older cities since those cities had like the oldest roadways. And so there's a higher concentration of gasoline that may have ended up in the soil in those areas. And then we're also working on some sacred site permaculture efforts, and Patricia could talk about that more.
Yeah, and I definitely want to really emphasize, like, thank you, Juan and Maya, for like really going into detail with the social justice, like, kind of background of this work as well, because I think it was really the combination of like the science and the movement work on the ground that made this possible. Like, I really want to emphasize what Maya mentioned, that we went from a situation where it was a city council member who said what the quote that Maya shared, city council member Jose Soloria, who said, maybe parents are just letting kids eat dirt and that's why they're getting affected by lead contamination. But that wasn't the only thing. You know, there was healthcare officials who were saying that maybe people were crossing the border too often in our community and that they were being exposed to lead in other countries and bringing it here. Or like, you know, Juan mentioned the whole stereotype around Mexican candy and Indian spices, right? But the reality is, and what we brought up, all of our community members and myself, was that this is poisoning that was happening in the ground beneath our feet. And after, you know, several different times that we did marches and protests and we did public comments at city council meetings, we had to tell the city council and the city government, like, your legacy will be allowing children to be poisoned by the ground beneath their feet unless you do something about this. And it wasn't until, like, you know, several years of that action that finally the mayor apologized to us, actually, and agreed to make these changes. So I just really want to emphasize that, like, this is a huge community effort that brought this science together with the demands of the community to make this happen. And it's no small feat, especially for a community that doesn't have many resources like our own. And I think from the beginning, this work, you know, I'm since coming into OCEJ as executive director, my family's Cuyute Ganawa. We're a native group from Southwest Mexico. And since, you know, my family's been here, they've kind of told me, like, if we're living here outside of our homelands, we have an obligation to work with the people of this land to care for this place. And so that's when I first joined OCEJ, I started bringing together work with the Akashman and Tongva tribal nations of Southern California with the low-income urban communities in Santana, Anaheim, and Fullerton, and throughout Orange County, because that was a bridge that hadn't been really crossed yet, right? Of bringing together these two kind of separate movements for social justice and reuniting our strengths in that way. And one of those things in common was that while Santana was dealing, and other urban areas of Orange County are dealing with this lead contamination in the soil, the sacred site of Pavona, which is a place of emergence and the incredibly important place of cultural gathering for the Akashma and Tongva people. Recently, Cal State Long Beach, a university in the city of Long Beach, dumped 6,400 tons of arsenic and lead contaminated soil and debris across their sacred site, where their ancestors are buried and where ceremony continues to happen throughout the year. And so it was a huge affront to the indigenous communities of this place. And as a result, there was a huge fight to be able to protect Pavona from further damage, to get the university to be accountable, and to restore that sacred site to the Akashma and Tongva people in a land back movement. And ultimately, the lawsuit was settled and Pavona was protected in perpetuity, but the university only agreed to do so by saying that we had to clean up the 6,400 tons of contaminated debris that they dumped on the site. And so it was actually both of these simultaneous issues happening that brought us together with the researcher, Dr. Danielle Stevenson, who at the time was a student at UC Riverside. And she, like Maya mentioned, was developing these bioremediation methods that are very much locally based, right? She would go to toxic sites to see what were the plants that were naturally springing up there that had the ability to bioremediate. And that's how buckwheat and telegraph flower, or telegraph weed, were identified. And so while we were doing this bioremediation work in Santana, at the same time, we started doing the same thing at the sacred site of Pavona to be able to address the contamination there. It's an ongoing effort, but one of the really important things about selecting these native plants based on what's already happening in the area is that at the same time as we're mediating those contaminants from the soil, we're helping to restore the native ecosystem at those places to make sure that life can thrive in the way that it's supposed to in those places, and to restore a lot of the ceremonial plants that are really important for the Akashma and Tongva people. So we really are happy about how these two movements kind of move forward together in that way towards the common goal of a clean land for us all.
And I know that we have to probably be wrapping up, so I'll just add or basically restate our argument here, right? So the work that Patricia and Maya and everyone, all the different organizations that are connected to this Plono coalition is breaking with a paradigm, a research program that was very focused on the individual. It was very medicalized. It was very much always done through the lens of medicine, and also through the funding of medicine, right? So the structure of funding of medicine. And this group is actually addressing it not just as a kind of in terms of the scale, as a community level problem, but also as an intersectional issue, right? That connects to other issues of social justice, because we see it as all interconnected, right? Now, this approach to environmental justice is being discussed among academics and activists as critical environmental justice, right? Understanding that the struggles of residents fighting against pollution, which is the sort of the quintessential idea that we have about environmental justice, is actually not detached, not in opposition to the struggles of workers for wages, of tenants for housing rights, of the LGBTQ community for their rights, and against discrimination and so on, right? So against prisons, against land dispossession and histories of land expropriation, right? Indigenous struggles. They're connected. And moving forward, I think we try to embody that that vision and that approach in the work that we do. So for everyone here in public health in Michigan, at Michigan, think about how you can embody that practice as well. So like Maya mentioned, something that we're working on right now that can cross-cut through different departments and outside the university is these like soil testing campaigns, student-led soil testing campaigns. We don't have data about the soil, right? It's just not available unless you have a super fund or something like that. So wouldn't that be a great opportunity to get students involved and get them out there, reach the communities, talk to people, organize, share materials, share experiences, and build power in the process, build community in the process, right? So I'll leave you with that, and I think we can open it up for everyone if you have questions.
Thank you. With so much gratitude for Juan, Maya, and Patricia. We only have a minute or two. There's one technical question here. I think, Juan, you just beautifully summarized some of the key takeaways, so I appreciate that. And we shared lots of links and resources for folks to follow up and learn more about your work. So Maya, I know you said that there was more to share, so we'll get that out to folks, but appreciate you all being here. The technical question was just about the plants themselves after they are used for bioremediation. Do you have any sense of how they are harmed, or they are, are they safe to handle?
Yeah, I think I answered. I think I put in the text, but I can definitely repeat it again out loud. Basically, the plants are that need to be handled carefully, and they can be concentrated into a sludge, like all the plants together. So it's a lot smaller to dispose of as opposed to the soil. So it's a lot easier that way. But yeah, they're not safe, definitely not to eat or anything like that.
Let's see. I was going to also just appreciate, just a thank you. Yeah, we're pretty much at time, so we can't get too far into the weeds, if you will, on any of these things, but just really appreciate you. I don't know that we've done any residents and researchers that have pushed us so much to sort of rethink the narrative around some of this work that we all do. And we all have, some shared goals to really push on environmental justice and make it happen, and really asking us to critically think about that history, those connections to the earth. Maya, you mentioned healing. I don't know that we talk enough about these things in environmental health sciences. And so really just appreciate you all sharing what you do and inspiring us all. So we'll leave it at that for today. And thank you for being here with us.
Thank you all so much for having us. Take care.
Everyone.
Thank you so much.
Thank you, everyone. Thanks so much.